Colon cancer, often a silent predator, is a condition that can develop and progress without making its presence known in the early stages. By the time symptoms do manifest, the disease may have already reached a more advanced stage, making treatment more challenging. So stay with us until the end to discover 8 critical symptoms of colon cancer. Symptom number 1. Change in bowel habits. One of the most common and often overlooked symptoms of colon cancer is a persistent change in bowel habits. This symptom can be subtle at first, making it easy to dismiss as a minor inconvenience or a temporary digestive issue. However, it's crucial to pay attention to these changes, as they can be an early warning sign of something more serious. This can manifest as diarrhea, constipation, or a feeling of incomplete emptying after a bowel movement. Diarrhea might present as frequent loose or watery feces, while constipation could mean having fewer bowel movements than usual or experiencing difficulty defecating. The sensation of incomplete emptying can leave you feeling like you still need to go to the toilet, even after you've just had a bowel movement. These changes might be accompanied by a noticeable difference in the consistency of your feces, such as unusually narrow feces. Narrow feces, sometimes referred to as pencil-thin stools, can indicate a blockage or narrowing in the colon, which is a potential sign of colon cancer. It's important to observe the shape, size, and texture of your feces, as these characteristics can provide valuable clues about your digestive health. Pay close attention if these changes last for more than a few days or if they become a recurring issue. Temporary changes in bowel habits can occur due to diet, stress, or minor infections, but persistent or recurring symptoms should not be ignored. Keeping a record of your bowel habits, including the frequency, consistency, and any accompanying symptoms, can be helpful when discussing your concerns with a healthcare provider. Symptom number 2. Blood in your feces. Discovering blood in your stool can be unsettling, and it's important to understand what it might mean. Blood in the stool can appear in different forms, each providing clues about where the issue may originate. Bright red blood is often associated with bleeding from the lower digestive tract, such as the rectum or anus, and may be caused by conditions like hemorrhoids or anal fissures. However, darker blood or stools that look blackish typically suggest bleeding higher up in the digestive system, such as the colon or small intestine. Sometimes the blood may not even be visible to the naked eye but can still be present in trace amounts, known as occult blood. In addition to the color, the amount of blood and whether it appears with other symptoms can provide further insight. Blood in the feces, whether occasional or recurring, is never a normal occurrence, and understanding these patterns is key to identifying potential issues early. While there are many benign causes, it's still important to remain attentive to any changes to your digestive health. So don't self-diagnose or dismiss this symptom. Symptom number 3. Persistent abdominal pain. Persistent abdominal pain or discomfort, especially when accompanied by other symptoms like changes in bowel habits or blood in the stool, should never be ignored. This pain might manifest as cramping, bloating, gas, or a feeling of fullness even after eating a small meal. Unlike occasional stomach aches caused by common issues like overeating or indigestion, persistent abdominal pain could be a sign that something more serious is happening within the digestive system. When this type of pain occurs alongside other symptoms, such as changes in bowel habits or blood in the stool, it becomes even more significant. This combination might point to an underlying issue like inflammation, obstruction, or even early signs of colon cancer. The location of the pain can also offer clues. For example, discomfort in the lower abdomen may be associated with the colon. Paying close attention to the duration, severity, and accompanying symptoms of abdominal pain is essential for recognizing patterns that could indicate a deeper problem. So don't try to tough it out or self-medicate. Seeking professional evaluation is crucial. Remember, your body often gives you signals when something is wrong, so pay attention to them. Symptom number 4. Unexplained weight loss. Unexplained weight loss, which refers to losing weight without any changes to your diet or exercise routine, can be a concerning sign of an underlying health issue. While many factors can contribute to weight loss, including stress or illness, persistent and unexplained weight loss may point to something more serious, such as colon cancer. When cancer is present, the body may have difficulty absorbing nutrients efficiently, which can result in a loss of body mass. Additionally, the body often uses more energy to fight off the disease, leading to further weight loss. This type of weight loss is typically gradual, and if it occurs alongside other symptoms like fatigue, abdominal pain, or changes in bowel habits, it may suggest that the body is not functioning properly. Weight loss due to cancer can happen even if you are eating normally or more than usual, as the body's energy balance is disrupted. It's important to be aware of any unexplained changes in your weight, especially if they persist over time. Symptom number 5, fatigue and weakness. Everyone experiences fatigue occasionally, but persistent and unexplained fatigue, especially when accompanied by weakness, can be a red flag for underlying health issues, including colon cancer. Anemia, often caused by internal bleeding associated with colon cancer, can contribute to feelings of fatigue and weakness. This type of fatigue is different from the usual tiredness you might feel after a long day. If you're constantly feeling drained even after a good night's sleep and simple tasks seem exhausting, don't hesitate to seek medical advice. Persistent fatigue can significantly impact your quality of life and may indicate a serious condition that requires prompt attention. Symptom number 6, pelvic pain. Pelvic pain is a common and often misunderstood symptom, as it can stem from a wide variety of causes, both minor and serious. When the pain is persistent or recurring, it becomes important to pay attention to its nature and any associated symptoms. In the case of colon cancer, pelvic pain might be felt in the lower abdomen or pelvis, and could even be a result of tumors pressing on nearby organs or tissues. This discomfort may vary in intensity, from a dull ache to sharp or cramp-like sensations, and could be aggravated by certain movements or activities, such as eating or defecating. Pelvic pain may also be accompanied by other digestive issues, which may indicate a more serious problem. In some cases, pelvic pain can be mistaken for other conditions like menstrual cramps, urinary tract infections, or even gastrointestinal disturbances. However, unlike occasional aches, this pain is often constant and doesn't go away with over-the-counter remedies. Symptom number 7, unexplained nausea or vomiting. Unexplained nausea or vomiting, especially when it occurs frequently or without an obvious cause, can be a troubling symptom. While occasional nausea can result from common factors like overeating or motion sickness, persistent or recurrent nausea that comes without warning may be a sign of something more serious. In the case of colon cancer, the nausea could be caused by a blockage in the colon or an inability of the body to process food properly. As the tumor grows, it can disrupt the normal function of the digestive tract, leading to a buildup of waste and gases, which can trigger nausea or even vomiting. In addition to nausea, vomiting may occur, especially if there is an obstruction in the colon, or if the cancer has spread to other areas, affecting the stomach or intestines. This symptom, when combined with others, should be taken seriously. Loss of appetite is another symptom that should not be ignored. If you notice a significant decrease in your appetite, it could be a sign of an underlying health issue, including colon cancer. Our bodies are designed to signal when something isn't right, and a sudden lack of interest in food can be one of those signals. This isn't just about skipping meals or not feeling hungry for a day or two, it's about a persistent change in your eating habits. When your body is fighting an illness, it often diverts energy from non-essential processes like digestion to focus on healing. This can lead to a decreased appetite. Additionally, tumors can produce substances that affect your body's normal appetite regulation. If you experience a prolonged loss of appetite, especially if it's accompanied by other symptoms like weight loss, fatigue, or changes in bowel habits, you should definitely look into that. Bonus symptom, changes in feces odor. These changes can sometimes be linked to colon cancer, particularly when the disease affects digestion or causes blockages in the colon. A growing tumor may disrupt normal digestion and gut bacteria, leading to more fermentation and gas production in the intestines, which can result in foul-smelling feces. Additionally, if a tumor causes partial obstruction, it can slow bowel movements, leading to constipation and a buildup of waste that ferments longer, further altering the feces smell. In some cases, as we have mentioned before, colon cancer may also cause bleeding or increased mucus production, which, when mixed with the feces, can make them smell even worse. So while changes in the feces odor itself are not a major symptom of colon cancer, it can be when it occurs alongside other more common signs. So there you have it, 8 critical symptoms of colon cancer plus a bonus symptom. Remember, early detection is key in successfully treating this disease. If you experience any of the symptoms discussed, don't panic, but don't ignore them either. Schedule an appointment with your doctor and discuss your concerns. They can assess your individual situation, consider your medical history, and recommend appropriate tests or screenings if necessary. Your proactive approach to your health could be life-saving. Thank you for watching. If you found this video helpful, don't forget to like and subscribe for more health tips and content. See you all next time.